A quick review: the pharmacology of autonomic drugs, sympathetic. So we have seen the sympathetic nervous system, how it will be releasing the nerve terminal, will be releasing the norepinephrine. Norepinephrine is going to interact with the alpha 1 receptors in the vascular smooth muscle and will be leading to a contraction. The contraction in this vascular smooth muscle is going to increase the peripheral vascular resistance and will be leading to an increase in blood pressure or hypertension. Also, we have the bladder and we have the prostate gland. In the prostate gland also we have a smooth muscle. They containing also alpha-1 receptors, and the norepinephrine will be interacting with these alpha-1 receptors to produce a contraction in these smooth muscles. So now if we are going to use an alpha-1 antagonist, which will be more specific for the blocking the alpha-1 comparing with the alpha-2. So this medication now will be going to block the alpha-1 receptors and will be preventing the contraction in the vascular smooth muscle and decreasing the peripheral vascular resistance and finally treating the hypertension. The same if we block the alpha-1 receptors in the smooth muscle in the prostate gland is going now to increase the urine outflow. So this medication, the alpha-1 antagonist, we have a different medication: prazosin, terazosin, doxazosin. I am just mentioning here the dose to see that about the potency of this medication. Now, this medication, by blocking the alpha-1 receptors, so they are going to relax both the arterial and the venous vascular smooth muscle. Beside, as I mentioned, will be relaxing the smooth muscle in the prostate gland. So the major utilization for it is in males who have at the same time hypertension and a benign prostatic hyperplasia. So we have seen how using the alpha-1 receptor antagonist, which will be specific for the alpha-1 to block it, will make now the norepinephrine more available to produce a negative feedback upon the stimulation of the alpha-2 receptors, which located presynaptically. So now norepinephrine will be produced and oppose negative feedback. So that will be leading to a decrease in the production and the release of norepinephrine. The decrease in the release of norepinephrine will be responsible about some of the toxicity for these alpha-1 antagonists. However, the toxicity, it will be infrequent and mild. And we are able to predict the type of toxicity since we are decreasing the blood pressure, so the patient might have dizziness. As a reflex, will have an increase in the heart rate. Besides, he might be having a headache and a lack of energy. Now, these three medication for the alpha-1 antagonist, it's supposed to be given the first dose. It's supposed to be small and should be administered at the bedtime to avoid what we call it the first dose phenomenon, which means that we have, if the patient will standing up, he will have a drop in the blood pressure. Usually that will be happening with the first medication more than the other, with prazosin, and the patient usually will used to it with increasing the dose gradually, and with time he will used to it, so he will not be having this phenomenon. Now mentioning three drugs: tamsulosin, alphozeusin, silodosin. These medication given orally, once daily. The most potent among them is tamsulosin, as you can see it. Now, these medication, they are very specific alpha-1 antagonist, specifically for the alpha-1 type A and D. So for that reason, they are used only for the management of benign prostatic hyperplasia, because that alpha-1 type A is present more in the smooth muscle in the prostate gland. Now, these medication, some of them, they have a specific toxicity. Like for an example, tamsulosin, it may be increase the incidence of what we call it a floppy iris syndrome during the operation for a cataract surgery. And alphozeusin, it will be might be increasing the risk of QT interval prolongation in some individual.